So without further ado, I'd like to introduce our keynote speaker, Dr. Anisha Patel. So Dr. Anisha Patel is a general practitioner and a bowel cancer survivor. Since recovery, she has returned to work as a GP and campaigned to raise public awareness of bowel cancer. She is now a speaker, health educator, writer, and media doctor, and has written a book released earlier this year, Everything You'd Hoped You'd Never Need to Know About Bowel Cancer. She's taken part in a variety of health and cancer-related campaigns for the NHS, charities, and ITV, and works hard within a variety of media outlets to push a range of health education agendas and break down stigmas and taboos associated with health and illness. She has a vested interest in and experience of talking about survivorship and life after cancer, helping others navigate through this most difficult and often unspoken about phase of life. So Anisha, I will now hand over to you.
My name's Dr. Anisha Patel. I'm also known as Doctors Get Cancer Too on social media for obvious reasons. Next slide, please. So today, as I said, I'd like to just go focus on my story, how my experience has changed me, how it's changed my practice. I'd like to touch on post-traumatic growth because I think that applies to all sorts of life-changing illnesses and experiences. And then again, at the end, talk about how patients and researchers, doctors can all improve patient care in bowel cancer and bowel disease, and hopefully take any questions at the end. Next slide, please. So I've had a lovely introduction. What I wanted to say was, for first and foremost, I'm a GP and I'm a mum and I'm an exercise and food lover, and all the things in red very much came after cancer. And so actually there's been a whole evolution in who I am since my diagnosis. Next slide, please. So my experience was this, actually 5 years ago, so I'm reaching my 5-year milestone soon, I was diagnosed with stage 3B rectal cancer. I was a busy working mum. I had symptoms that I thought were IBS initially, such as constipation, a bit of urgency, needing to go to the toilet more frequently, and then a bit of blood on the tissue, which I thought was due to piles that I'd had at childbirth. But as time went on, symptoms got worse, and I obviously went to my doctor. And after a couple of visits, I was referred and I was diagnosed and went on to have surgery to remove the tumour in October 2018. So I've had part of my rectum and part of my colon removed, and I had an ileostomy short term. In fact, it was very short term. I only actually kept mine for 3 weeks, which is unusual, but I had quite a high output stoma at the time. And I then went quickly on to have chemotherapy, and I had 4 cycles of oxaliplatin and capecitabine. And if anyone's had that, they know quite how grueling that can be. The next slide, please. My 5-year milestone, as I mentioned, is looming. I'm currently awaiting a CT scan, but I've been completely blessed to be in remission so far, which has been amazing. I have had 2 colonoscopies in those 5 years subsequently, and I'm on 3 yearly colonoscopies till I reached bowel cancer screening age. Just to note, was diagnosed at the age of 39. I had no family history. I had no risk factors. And my children were 6 and 7 at the time. So obviously there is, for me, that worry, even though they haven't found a definite gene for it, there's always that worry about my family and the impacts it might have on them. And subsequent to that, I've been sort of navigating life after cancer. It's been one hell of a roller coaster, one big marathon with good and bad days and everything in between. But I just wanted to share more about what's happened to me subsequently. Next slide, please. So as many of you know on here, life after any diagnosis, whether that be cancer or inflammatory bowel disease or any other bowel diseases, it's a chronic illness. And I remember my husband, who actually is a gastroenterologist and actually removes bowel cancers early, and screening lead for bowel cancer screening, I remember he said to me, you've got to think of cancer as a chronic illness, because it's not, you know, when you finish treatment, you're left actually with a lot of things afterwards to deal with. And that's the same if you have other bowel diseases and you're on therapies or immunotherapies or whatever you're on, you know, it all comes with baggage, both mentally and physically. And it definitely is the gift that can keep giving. And for me, these were the sort of things that I left with. The things in red are still very much can be problems day to day, but less frequently. So I have got a cold-induced nerve pains in my hands and feet. So you'll often find me wearing bed socks around my cold floors in the house. We know that fatigue after cancer treatment can last more than a year, and thankfully I don't have that, and my fatigue is probably more to do with running around like a loon. I have LARS, which is something called lower anterior resection syndrome. So this is bowel dysfunction that you get after you've had bowel surgery, particularly for rectal cancers, where you've had half of your rectum removed, which which is essentially your storage capacitor. So I've already been to the toilet 6 or 7 times today. You get clustering, you may get urgency, you get a change in your function. And that's been in itself something that I've had to learn to manage. And then we also talk about the mental health aspect, which is absolutely huge. And I don't think I ever appreciated as a patient or as a doctor quite how much this impact can be. And that varied from things that I experienced from anxiety to fear, grief, claustrophobia. And it took me a while to accept that I actually had PTSD. And I think because of the job I had as well, I constantly had triggers when I went back to work. And I also came back to work just, not long before COVID started. So everything was quite sort of stressful and triggering. I also had kidney scarring, where I've had, a keloid scarring, which is scarring over your scar sites. Often that happens in Afro-Caribbean or Asian skin, where you get thickening and it can be painful. Kidney sort of function isn't as good because of chemo. And obviously when I went through treatment, I was asked about fertility. And I was obviously very blessed with 2 children, but obviously I'm unable to have children now and have gone through a medical menopause. And then we have all the other things, such as dealing with going back to work, side effects of treatment, dealing with the new normal, but also we've got positives that we can take away from this as well. Next slide, please. So how has cancer sort of changed my practice? There is no shadow of a doubt that cancer has changed my practice forever, and probably in a good way. But also I recognize that my own experience can impact my healing, my growth, my recovery, and it does get to me more than usual some days, because, ultimately as a general practitioner, a lot of my work is trying to make sure that people's symptoms aren't cancer. But what I have really, really, really appreciated is the impact that I can actually have. And that's not in a sort of grandiose way, but actually what people say to you, health professionals, can actually last a lifetime. And when I was diagnosed, the first comments that were given to me were, "It's nasty." And that's just ingrained in my head forever. And, I almost wish someone had said, it's not good news, it's cancer. You use the right words, because actually these words can stick with you, and a negative experience can really last a lifetime with someone. But, a positive experience with a healthcare professional, and the positive ones I had with mine, really make you feel empowered, like someone's got your back, and that you can totally do this. So I'm very mindful of that. I've also think I have an empathy much deeper than I ever had before, because I really get it. I was a patient for a long time. I still am a patient. And I understand the ripple effects of what a life-changing diagnosis can make, not just only on the individual, but I also look after that individual's family. So I see that, and their friends, and an empathy of illness, and how actually when I get to see patients, often after treatment, this is actually when they need the most support. So having that deeper understanding both from a physical sense, but also understanding mental health so much better, because before cancer, I would say I had good mental health generally, but actually having gone through experiencing all these different things, it's actually made me a better doctor. People often ask me about my threshold for investigation, and absolutely, I think when I first came back, I was very on tenterhooks. You know, I was so worried about everything being cancer, but I think I always felt that I referred appropriately beforehand, and I don't think long term my threshold has changed, but I'm definitely sort of meticulous in that. And as an employer, you're very much more sympathetic to those returning to work. You have a better understanding, you have better open, flexible conversations, because this is something I talk about a lot with actually corporate companies, about how you rehabilitate people back to work who've got chronic illnesses, who've had cancer. How can we be supportive, and how can we not make them feel an outsider? And I definitely focus on health promotion, health education, and cancer awareness, not just in my practice, but on a wider platform. Next slide, please. And cancer, you know, any bowel disease, anything chronic, it changes your life. There is absolutely no shadow of a doubt. And, you know, I wrote a list when I was really struggling, that the heading was "What Cancer Gave Me." And when I wrote my book, and I was writing about this in the book, I actually realized I was writing about this phenomenon called post-traumatic growth. And post-traumatic growth is this positive psychological changes or transformations that can occur as a result of the struggle with trauma, or a highly challenging situation, or a life-changing situation. And not everyone has to experience this. This is not something that everyone experiences, but inadvertently I realized I had. But that's not to say that negatives didn't run in parallel. That's not to say I was all positive and glowing and happy, and yes, I've got to grab life. But it was a struggle. It really was a struggle those days. And the growing, the healing, the recovery, the ups and downs were all part of this post-traumatic growth and healing for me. And there's 5 headings there for post-traumatic growth that you could see at the bottom. There's the spiritual development, new possibilities or opportunities. So, you know, trying to say, yeah, just go out there, go do it. Personal strength, and that optimism that you can do things, and got a growth mindset. Close relationships, knowing who you cherish, and who you don't cherish as well, and a greater appreciation of life. So just almost more gratitude. And I just want to go on to the next slide, and I'll talk a bit more in detail about actually, for me, what happened. So there was just a greater appreciation for me of all things big and small. I remember in COVID saying to my husband that I thought the outside looked more colourful and that the flowers were brighter. And he said, no, I think it's the same. But I just took that time, that appreciation, that moment to actually appreciate things. And I just feel generally I've got more fulfillment and pleasure in life, and I say try, I'm not perfect, try not to sweat the small stuff. And I noticed that with time and with cancer, the highs I experience are just like no other. Like, I've never felt such strong emotions, but also the lows can feel really low as well. I've definitely got more spontaneity. I think I probably exhaust my family and friends with this some days. And, you know, making memories for me have always outweighed material things, but even more so now. I try and almost practice gratitude each day, even when you have a really rubbish day, just so that I bring myself back to actually looking at just how far we've come. Personal strength. I mean, this is something that I think for all of us that have suffered any sort of life-changing illness comes in bounds. You know, I actually surprise myself with the tenacity and resilience some days. And now knowing how brave and courageous, actually looking back, I was, it's actually important to acknowledge that. And I am proud, and it's okay to say that, and also astonished at what my body can do, how it's healed, what it's seen me through. And even though I have days where I get utterly frustrated with it, it is amazing. And I've learned to start saying no. That's something that a lot of us find difficult to do, but I'm trying to say no so I can focus on the things that I really want to say yes to, because we could all get sort of caught up on saying yes to everything, but actually not doing what we really want to do. And I've definitely tried to look after myself more, still not the best at times, but opting for more self-care, more preservation, because that's so important for recovery. And it's so important when you're living with a chronic illness, because it can be so exhausting. And I don't tolerate, things that before I might have just gone, oh, that's okay. I will call people out on it, because sometimes those things can be hurtful to others, even if they don't mean it. So yeah, it's important to just be true to yourself. Next slide, please. The other three are obviously new opportunities and new possibilities. And, as you saw the slide at the beginning, I was really happy being a GP, a mum, an exercise lover, food lover, traveller and all that. But obviously all those other things and hats that I now wear have all come because of cancer. And I'm not saying that everyone who has a chronic illness or cancer has to do that, but it has been very much my coping mechanism of turning this negative into a positive, and using my platform as a doctor to then help sort of bridge that gap between patients and doctors. This whole experience has been an education about the disease, about illness, about mental health, and about myself. And having to accept my new normal means that I still know that things are still possible, when actually at the beginning I really doubted it. So I did run the London Marathon. I have written a book. I'm working with charities, working in the media, trying to get big messages out there and campaigning, because, ultimately that's my passion. That's what makes me tick now. And that's my drive, that we can do better. Closer relationships. So I think a lot of you will know that, you've got to find your tribe. And, I have formed unbreakable bonds with so many individuals. When I had cancer, so many people came flocking in. And when I finished treatment, so many people left again. But I've been left with a core group of people that I can rely on. And those relationships have grown stronger. I've also gained new friends through, social media, through the cancer community, through all the other charities I've worked with. And actually what's been really special about these relationships is it's an unsaid understanding that I sometimes don't have with my friends, especially as I was diagnosed at 39, and other people just didn't get it. And so I really appreciate those relationships. And I also have close relationships almost with my patients, because I really feel I can get on a level of empathy with them. And actually, I truly do get it. And spiritual development. So coming to a point, I accept what has happened, and I do accept that. And for some people, they find God and they find spirituality. For me, I was brought up Hindu, and actually, I'm happy to share that, I actually lost sort of any sort of faith that I might have had. And that's obviously very personal, but it is part of the growth that I experienced as well. Next slide, please. So what would I tell clinicians now that I know? So I would tell them that words and actions can last a lifetime. So however we behave, and I know it's difficult, I have bad days some days, and, we're not always, we all make mistakes, but knowing that actually what you say and the way you deliver it is so, so important. And the smaller acts of kindness and humility are so important. So when I was crying as I went through under general anaesthetic, having the anaesthetist actually just take my hands, wipe away my tears, actually was what I needed at that moment. And actually empathy, like, it's really difficult if you've not been through it. It's really difficult to teach someone that. It's not something you can learn, but it is important that people try and truly listen. And one of the things that we are taught, particularly as general practitioners, is that we should be listening to patients' ideas, concerns and expectations. And I think that's really important for you to remember, that when you go to a consultation, that you actually think about what are your ideas about what your symptoms are, or what treatment you think you might want, or what you've read up on. What are you concerned about regarding your condition or that treatment? And what do you expect that doctor to do? Because actually I will try and ask my patients those things so that I can hopefully meet their agenda. And not dismiss patient concerns, which is something that I've heard so often now in the last 5 years while I've been working within patient communities. And it's obviously so upsetting for me to hear as a clinician, but something that I'm definitely trying to pass on to my colleagues. And I always have a rule of 3. So for me, if a patient comes 3 times with the same problem and is worried, do the test, because even if you do relieve their, it's mainly anxiety driven. A, you relieve that anxiety of the patient, because that patient shouldn't have to live with that. And B, actually, that symptom is still a problem. The patient finds it a problem. You may find something that you're not expecting. So it's so important that you do that. Next slide, please. How can we all work together as patients and doctors to improve patient care? And I really had to think about this, bearing in mind the agenda for today. And I think it is important. It works both ways, and we need education of both patients and doctors. So we need to educate doctors that, you know, cancer can occur in young people, that actually, you know, their patients need to be listened to better, etc., etc. But with patients, we need to try and break down the taboos and the stigmas and get people forward and improve their knowledge of illnesses, of cancer symptoms, of screening programs, and the importance of actually getting these tests or coming to see your doctors if you've got any concerns. We need to make sure that we're keeping communication channels open with our health professionals and with our patients. So trying to ask more open questions. And I ask patients often to, when they come to a consultation, have key points that you want to discuss. Often I can get lost in a patient's thoughts because they go to different tangents, and I don't know what that one problem that's truly important to that patient is right now. And sometimes then it can be quite unsatisfying for patient and doctor, because we don't get to the bottom of what they need. And that goes on to documentation. So keeping symptom diaries, keeping a few notes. I don't mind if there's a couple of notes and you want to read me out of things, that's brilliant. And same for the doctors. From our point of view, it's making sure we keep good notes so that we can make sure information is not lost in translation. So when the next doctor comes to see a patient, patients don't always have to keep going over and over and over things, which I remember doing and finding really difficult. But there are some circumstances that you do need to be asked questions again. This is a real passion of mine, tackling health inequalities and health gaps. We know there's a gender gap. We know there's health inequalities of people from deprived backgrounds, from ethnic community. And, you know, that is a massive problem and something that is being or starting to be addressed. And one of the things that I know is a massive problem is data and research, particularly in these areas, because a lot of data, for example, take bowel cancer, is done on older age groups, because that's who bowel cancer would typically affect. It's done in predominantly a Caucasian or white community, and often more men than women. And so we need research that represents everyone from every background, every age, every ethnicity, so that we can, and we need to then encourage these groups that often don't want to come forward to research or come forward for healthcare to participate, so that we can get the data that we need. And I think it's always important that we give feedback to each other. So I don't mind patients giving me feedback, and, you know, I wouldn't so much give patients feedback, but you might give feedback on their symptoms, for example, but feedback also should work both ways. Next slide, please. And that's the end. So that is my book there in the corner. I think we've run out of time, but I'm really happy to take any questions. And I hope that was useful and I guess insightful.
Thank you so much for that, Anisha. And yes, if you have any questions for Anisha, please do put them in the chat or in the Q&A. Liz says, thank you, Anisha, for such an honest and thoughtful talk. Your positive attitude is inspirational. I wish you well with your future follow-up.
Oh, thank you. Thank you. Fingers crossed. Yes.
Yeah, I mean, you said lots of stuff in there that really resonated with me, and actually I didn't expect to well up at this time of the morning, but when you mentioned the anaesthetist wiping your tears away, that did get me, and that will stick with me. That's lovely.
Yeah.
While people are just kind of typing in the chat or the Q&A, if I just sort of kick off, I would, as a writer myself, I'd love to know a little bit more about your book and kind of the process you went through with writing that. I mean, did you write before, or is that something that cancer kind of spurred you on to do? What was it like to write about it?
Yeah, so I think as some of you may know, so the at Doctors Get Cancer 2 handle on Instagram came about as a blog that was set about for me to cathartically write. and to start raising some sort of awareness. Because when I drove home with my husband the day I was diagnosed, I said to him, with his speciality in bowel cancer as well, we've got to do something with this. And so through that blog, I started to write. And what I didn't realize was that actually I became a writer through cancer, because everything that I needed to process, I would write down on my phone. I'd then think about it. I'd then post on Instagram. You'd then have the amazing supportive comments from people that made you and helped you think, and supportive advice. And I'd also share the medical bits that I was learning along the way, because I was thinking, actually, I can't find this always on the internet or the leaflet. So I started to share stuff that I was learning from my own illness, and using my patient and doctor hats to then put that out there as well. And I know people had said to me, oh, you should write a book, because actually that's quite helpful, because you're giving the emotion and the personal thing, but you're also giving the practical advice. And so I was thinking about it for a long time. And then I actually had a GP mentor on my return to work who supported me. And particularly with this other side of work I'm doing outside of general practice, which she says that I often like, the room lights up when I talk about it, compared to my everyday job, because that's where my passion is. And I said to her, I'd really like to do this. And she said, why don't you just pin down the first couple of chapters? And lo and behold, 3 months later, someone actually approached me through my work to write a book. And, you know, Dame Deborah James, you know, it was a time where actually with her profile, she had brought bowel cancer to the forefront, and bowel disease in the media. So actually people were listening, and they were starting to listen, and there was a desire to listen. And so I was approached to write a book, and then that was it. So I wrote the book, and they wanted me to write an A to Z of bowel cancer. I wanted to write about how you live with a diagnosis of cancer and how you move on after it. So I have written the beginning bit from the day you're diagnosed. I've taken my personal experience. I've taken experiences of others for things that I didn't experience, like radiotherapy or infertility, and how people moved on. And then I've basically sort of wrap that around my medical expertise of my healthcare professionals, and come up with a book that's hopefully relatable and authentic, which hopefully will help people. And it's just come out in the States and Canada. So it's really nice to be able to have a resource, because I couldn't find one for me when I needed it.
We've got a couple of questions in the chat. So Addie said, you mentioned that most people are diagnosed over 50. I was 41 and diagnosed and had a great GP, but I've heard otherwise in a lot of other circumstances. How would you advise people to make sure they get their concerns addressed?
Yeah, so this is a really common question, something I get asked all the time. And I think one of the most important things, what I was saying to you, was about making sure you get the right documentation, you get a symptom diary, write it out. If the doctor's not listening, please, if you're in a group practice, go and see someone else in your surgery. You know, we know that bowel cancer is on the rise in the young. We know inflammatory bowel disease is a risk factor for bowel cancer. And, you know, no one can ever be too fit, too young, too healthy, too brown, white, whatever it is. You know, I looked like this when I was diagnosed. I looked no different. And I was sort of a later stage diagnosis, running, doing everything. And I think there is an education that's one of the things I'm trying to do within healthcare professionals, to say, actually, all cancers, actually, you know, we shouldn't dismiss people's symptoms. And we've got tests now that are so easy. So the FIT test wasn't around in general practice when I was diagnosed. And we've got this simple poo test now that we can do to, you know, help make that diagnosis early.
I can see that we have a couple more questions. I think we've got time for one more, and then we will need to move on, unfortunately. Let's have a look. So Neil says, great talk. As a doctor, you were familiar with the side effects of treatment, but how did the actuality of them differ from the anticipation of them?
Do you know what? When you read the side effects on the leaflet or whatever they give you, you're like, oh yeah, you know, and actually Neil's completely right. The reality of it, and I think that's what I wrote in great detail about. because it shocked me. It really shocked me. There was a day, comedy moment, I couldn't get out of bed because of leg cramps from the chemo. My husband actually, bless him, lifted me and then headbutted me into the door frame. You know, I've got, you know, all sorts of memories of just situations like eating my first salt and vinegar crisp after chemo, and the neuropathy just sent daggers down my throat, and I didn't know whether to laugh or cry. So I think, you know, I've had to accept all the side effects now as a chronic illness, and actually I hadn't appreciated how chronic it might be, if I'm being completely honest.
I think that's all of the time that we have for Q&A, but people can find you on social, can't they? And they can follow you. Doctors Get Cancer too on Instagram, is that right?
Yeah. And yeah, I've got to dabble on the other ones like LinkedIn and Twitter, but I just
Lovely. Well, thank you so much for
having me.
Thank you.